This podcast has been produced under the WeSpark Health Institute as a part of the Cancer Undergraduate Research Education Program.
Hello and welcome everybody to the Student Inside podcast. My name is Omar Samarai and I'm joined today by
Kyle Banwell,
Ayawale Alarmshala,
Ibrahim Kazi.
And we were going to be talking about how socioeconomic status of individuals in Canada affects their cancer journey. But before that, we would like to start with our land acknowledgements.
Together, we honor the land that we are on. Today, we're joining from the traditional, ancestral, and contemporary lands of the Niswi, Ishkodewan, and Anishinabeg, the Three Fires Confederacy, Ojibwe, Odawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. I encourage you to take a moment to reflect on the land you are currently on and its original peoples.
Thank you, Ayo. To kick off the podcast, I would like to first start by defining what socioeconomic status is. Can you do that for me, Kyle?
for sure. Socioeconomic status is the social standing of an individual within a population. So this can be determined by income, race, social status, education, as well as a multitude of other factors.
I see. And, a lot of people might hear this and they say, why should I care about such disparities, even if, healthcare is free? And, why should we care? And what would you respond to them? Hey.
Yeah, I think, we live in Canada, which is obviously, one of the most racially, ethnically diverse countries in the world. Toronto's actually one of the most diverse cities in the entire world. And just from that alone, we know and understand that many different people, live here. And just that fact alone is going to cause variances in our healthcare. Even when we look at the statistics, we see differences because of who people are. And obviously that ties back to socioeconomic status, as well as, the varying factors that might alter these experiences by people. So it's just really important that we kind of, spread this understanding, because in having different types of lives, we also have different types of cancer care. I think it's just really important that we push this message out.
100%, I agree. As Ayo said, everybody comes from different backgrounds and different socioeconomic status. So everybody has a certain need, and it's not a one-size-fits-all thing. Okay, so let's start off by addressing the facts. Is there an actual issue here?
There definitely is. A study published in 2010 found that lower socioeconomic status is associated with worsened cancer survival. Now, the authors of this study, they wanted to find if socioeconomic status had a effect on the stage of cancer diagnosis. And throughout the study, they actually found diagnosis was unaffected. But when looking at survival rates and the overall prognosis of these patients, so long-term survival, there was a direct association between lower socioeconomic status and cancer survival.
Mm-hmm. That is very unfortunate, because cancer care is healthcare, and healthcare is a basic human right, in my opinion. What do you guys think?
Yeah, and just before we move on, to add on to that, there's also a study from the BMC Health Services Group, which examines the role of socioeconomic factors in cancer care. In this research that was done by them, it kind of just highlights how income and education levels significantly influence cancer diagnosis and treatment outcomes. So obviously the findings of this study just reveal that there's a huge disparity in cancer care because of, variances in socioeconomic factors. And obviously to conclude that, it just shows that we need a more equitable healthcare system. It also shows that actual research is being done in this area. Some people might hear the term socioeconomic status and just brush it off. They might not think it's an actual existing issue, but the truth is, it is an issue, and we kind of need to address it.
I agree, though. And, when we talk about socioeconomic status, I think the biggest players in here are, I would say, income and education.
No, for sure. Income definitely plays a major role in it. I recall from a guest lecture from Dr. Kathy Pfaff last week, she mentioned a study on how income directly relates to much higher cancer care. And speaking of Dr. Pfaff, she will actually be joining us later in this podcast.
Yeah, and to just continue on education, when people hear that education has an impact on cancer, you might just think that's a pretty strange idea because cancer is a disease at the end of the day. But you can just imagine a family coming from overseas, might be a married couple, they have kids, they might be well educated in their own country, but there is cultural context when it comes to cancer. So, here in Canada, that might come with education, that might come with being within a school system.
Adding on to what Ayo said, even within Canada, we have education problems. Within our own Indigenous communities, in their Indigenous languages, they don't have a word for the cancer. So to explain cancer is a little bit more difficult because they don't understand what it means.
100%, that can cause a lot of issues. A lot of people can go underdiagnosed, and that is a really big problem. I agree. Let's move on and discuss about how socioeconomic status actually impacts cancer cause. So how your job, for example, can impact the chances of you getting cancer. Does anybody have an example for that?
Sure. So say you work outdoors, say you're a construction worker, you're going to be exposed to sunlight much more than someone working in an office job. So this isn't an income-related thing. It's more just the environment of where you're working.
Mm-hmm.
If you're exposed to the sun all day, more UV rays, that can lead to higher rates of skin cancer.
100%. So that has to be taken into consideration when we discuss these issues as well.
Studies do show that the place of residence at the individual's cancer diagnosis does significantly affect their actual, health outcomes. Rural patients experience overall survival and disease-specific survival similar to that of those in urban areas, but specifically, those are large urban areas. But small and medium-sized urban areas experience worse cancer outcomes. So this is just an example of how the location of the cancer patient greatly affects their entire experience of cancer.
Yeah, that makes a lot of sense because if you're living in a small town, the nearest cancer center where you can get proper treatment could be hours away, right?
Mm-hmm. Yeah, for example, the other day I was looking at Timmins, which is not even that small, but it happens to be somewhat rural. It has 44,000 residents, I believe, which is, when you compare it to in our area, Leamington only has 24,000, and the closest cancer center to Timmins is in Sudbury, which is called the Northeast Cancer Center, which is 4 hours away. So that puts it into perspective,
Oh, and it's not any better for Indigenous communities here in Ontario, Omar. I am currently looking at a map by Cancer Care Ontario, which can be found on our link tree, where it shows that the density of Indigenous communities is way too far overall from major cancer centers in Ontario.
Yeah, and that's in Ontario, right? Like you can imagine these communities in Nunavut or any of the other northern territories, how far they're going to be from regional cancer centers.
Yeah, and to add to that, Kyle, I actually have a story about this. My friend, she's Abenaki First Nation from northern Quebec, I believe. And she was telling me when I mentioned that I'm taking the skiers class, and she's telling me that people who live on the reserves over there are usually not getting screened. I don't want to say it's because of neglect from the government, but it's a little bit too harsh. But there are a lot of factors that tie into this, including past trauma that might cause distress in government entities, which is sad, but somewhat understandable. So as a community, I think we need to work together, solve these issues, so we have a better life as a whole society and not be divided.
Okay, so obviously we've been talking for a bit, we've identified all of these different issues, But I guess the next step is to kind of come up with a solution to all of these issues, because there's no point in talking about a problem without trying to solve it.
You're right. Time for good news.
Yeah. So, yeah, the good news is that the Canadian government has actually come up with a 10-year plan. So, this 10-year plan it's been I guess installed as a document, and it's called the Canadian Strategy for Cancer Control. So, it pretty much just gives a clear roadmap that emphasizes personalized care, enhanced data use, and fostering partnerships. So, obviously, the goal of this document, or the goal of this plan by the Canadian government, is to actually ensure that every Canadian has equal access to high quality cancer care, regardless of their socioeconomic status or the various factors that might impact their cancer experience or living with cancer. So, the thing that I actually like about this plan is that it lists specific priorities in order. So, they have, quote unquote, decreasing the risk of people getting cancer as their number one priority. So this is then followed by diagnosing cancer faster, accurately, and at an earlier stage. Priority number 3 that I'm reading here is delivering high quality care using a sustainable and world-class health system. So by that, what I understand is that the goal is to increase the quality of the Canadian cancer health system. They've then got eliminating barriers to people getting the care they need, which obviously looks at the socioeconomic factors that we've talked about so far in this episode. And lastly, the Canadian government plans to deliver information and support for cancer patients, their families, and caregivers. So again, this plan spans over 10 years. They've written it down here as from 2019 to 2029. So obviously 10 years is a pretty long time. It's probably going to take a while, to implement these things. But, using resources like our podcast, I believe it can really help inform Canadians and bring us closer to our goal.
Talking about more long-term plans, Ontario has a plan called the Ontario Cancer Plan. It guides the distribution of cancer healthcare resources in Ontario, but it takes social, geographic, and economic factors into consideration. As part of the National Cancer Control Plan, it will help achieve health equity in cancer care. The Ontario Cancer Plan focuses on improving access for those impacted by socioeconomic factors, advocating for funding, training, and support services.
Well, that's wonderful news from you guys. As Ayo said, we hope that this podcast actually enlightens some of our listeners to first take action and educate others about such issues. So, just like Ayo said, so we can have a better functioning society overall.
Joining us now is Dr. Kathy Pfaff, who has kindly agreed to call into the podcast today to answer some questions of ours, with insights from an impressive and credentialed career in healthcare and academia. Dr. Pfaff has years of experience as a registered nurse and presently holds multiple positions at the University of Windsor, where she works as a professor, researcher, as well as the Associate Dean of the Faculty of Nursing. So without further ado, here's Dr. Kathy Pfaff.
Thank you for having me today, Kyle.
Of course. Before I jump into our questions today, let me start by thanking you for taking the time out of your busy schedule to be here. We greatly appreciate it.
It's my honor.
In your experience working in healthcare and as a researcher, how does socioeconomic background influence a patient's risk of developing cancer, and how does it affect their journey through cancer diagnosis?
Well, we know through decades of research on the social determinants of health that income and social status are the most significant determinants of health. And so they do have a negative impact on certainly some people, certain sectors of the population. They're factors that may make them more at risk for cancer. And we certainly know that has an impact on people's treatment, their ability to access cancer care, and then also their outcomes as well.
Okay. So these lower, you could say, socioeconomic groups, what exactly are the challenges they're facing when trying to access care?
Okay. So some of these could be economic barriers to affording drugs for cancer. And so in the Canadian healthcare system, the dollars are parceled out from the federal government to the provincial government. And there are differences in what's covered province by province. So some of the oral drugs that are provided may not be included on the formulary in some provinces. Some of them can be, patients can access them with exemptions, and then some of them for supportive care just aren't covered. And so for some people, if they are of higher socioeconomic status, or they have supportive people that are going to help them to pay for those drugs, then they can afford them. But unfortunately, there's many people that are experiencing cancer that really they can't afford some of these drugs. The other thing that comes to mind is access to molecular testing for some cancers, as well as being on a clinical trial. So clinical trials come with extra costs, such as travel. Um, um, as an example, that people that have lower socioeconomic status, I mean, it's a barrier for them to be able to access a trial.
As a researcher here in Windsor, have you observed any unique trends in socioeconomic status and the quality of healthcare specific to the Windsor area? Or is it pretty like evenly distributed throughout the province and nation?
Well, I think that certainly our new immigrant populations that often come to Canada, and we know we're in, the top 4 of multicultural cities in Canada. So we have a lot of new immigrants, and so there absolutely are health disparities among that group. Um, I'm trying to think what part 2 of your question was.
Just like kind of specific to Windsor, but I think you got to it there.
Okay, yeah,
The
so
diversity in the city.
exactly.
Yeah.
And, I didn't, along with that, is the stigma and marginalization that's real in healthcare. We know that it's happening. We know that there are racist behaviors that many people experience. And our research is telling us that's stretching into cancer care as well. And so we need to do a better job of that,
Yeah.
because people then will be hesitant to seek care. And if they have even one experience, research tells us that even one bad experience can make people not want to come back again. So in terms of cancer, that's a problem for screening.
Okay.
Yeah.
So would it be fair to say that it's not really limited to income or education? It's almost more of a cultural ethnicity, and all these other factors are playing a large role in it.
Well, I think it's intersectional, right? So all these things
Hmm.
intersect. But if we're talking about income, homeless populations are a population that absolutely has worse health outcomes. Certainly, cancer is one that screening can be almost non-existent for these people, and so they'll hit, acute care with cancers that are very progressed. But it's even that, if you want to look at socioeconomic status, that there is a phenomenon whereby healthcare providers will look at someone that looks as though they're poor, and they get different treatment. than somebody that is wealthy. And there's good data on that.
Wow, that's terrible.
It is.
So as you're kind of outlining, like it really is a complicated issue. So in your opinion, working in the field and doing research in it, what are like the policy changes that are needed to be addressed in order to help fix these disparities?
Um, well, I think it's a very complex problem. And so, we have structures in our healthcare system that are there because they make things more efficient. But sometimes those efficiencies can be a barrier to really knowing the person and knowing their story. And so, recognizing that people come to us with all sorts of experiences. And so you look at the intersections of these social determinants of health and how those influence people's health, people's past experience with the healthcare system, what kind of care they're even going to get in the first place. Because we know that there are unconscious biases that healthcare providers have. So, I think it starts with awareness as the best place to start for people that are working in healthcare, that are working in cancer care. It needs to be a part of education. And I think we're doing a much better job of that now. I can speak to nursing education. I think medicine has come a long way. But I think we now have to speak to the people that are in practice that were maybe missing that education as part of their programs. And helping them to realize that really for me, it's about relationships. When you build relationships, you're better able to understand what that person has gone through. And so some of the interventions that a provider might prescribe or recommend may not be affordable to someone. And so understanding what resources are out there to help people. And this is where I really see the value in communities, that in any community, there's people that are there that are available to help. And so if we're talking about income as a disparity, how do we help people secure food? How do we help people to be able to secure housing? And with any community, there's resources for that. And we think about our formal system of care as being what we rely upon. And we actually have to look at our informal systems of care and how do we bridge community with the formal system of care to say we've actually got a safety net within communities, people that are willing to step up and people that are willing to volunteer and help out.
I feel like you've kind of already answered my next question there with how you answered the previous, but on a individual and community level. So like myself as a student, anyone listening at home, how can we try to minimize these disparities?
Again, it starts with awareness, right? And I think we all need to reflect upon our biases. I think we need to reflect on our privileges. And I am a person that I consider myself to be very privileged, and grew up in a middle income household with a lot of blessings in my life, right? And so if we don't recognize that there are other people that don't share that same circumstance with us, we can turn a blind eye to people's needs. And so I think it all starts with reflection and that self-awareness. And I think we need to get ourselves educated. And so, I think about the University of Windsor and the programming that's being offered, the courses that are available to really unpack our own privilege and understand that, again, these social determinants of health are truly, they're 50% of what makes people healthy. And if we can, when we're working with people, understand the impact of those social determinants, how they're influencing that person's health and their life, and how they're intersecting, and just be more compassionate, right? And then think about, how can I help that person? And so being aware, and this is the other thing that I think is really important, being aware of the services that we have in our community, because there's a lot, right? And there's a lot that a lot of people aren't aware of. And so how can we link people with not only people that are able to provide practical support that help, economic resources for people, but also that much needed social support and other services that are available in our community. And a lot of us don't really know what's out there.
So, what inspired you to research healthcare disparities and what drives your current passion for research in the field?
Yeah. Well, I mean, as a nurse and as a professor of nursing, we start teaching our students in first year about healthcare disparities. So it's very much on our radar as nurses. Doesn't necessarily mean that we're that great at recognizing it. And a lot of that's just because of time. So I've seen a gap in that area. And there's some great, I think, pockets of projects that are happening, but there's certainly, as a researcher, there's always more work to do, right? And so our Indigenous populations are an example that, since the Truth and Reconciliation Commission has come out, there's hundreds of years of horrible things that have happened, right? And we've learned a lot about in cancer care too, that we need to do a better job of recognizing the trauma that they've experienced, and so their hesitancy to seek cancer screening. So there's a pocket of knowledge that we really need to understand better, and we need to do a better job in the healthcare system and in cancer. A lot of cancer programs have now embedded Indigenous navigators within their programs, and that's been a really, really excellent and culturally safe thing to do for that particular population. So I guess, my research program really revolves around how to improve the delivery of compassionate health care. And so to be compassionate, we have to understand. So we have to, although we can't fully understand, we want to be able to move beyond empathy, being empathetic for people, but to really fully seek to know what their experience is and then want to make a change. And so I was at a conference recently, and this book was mentioned. I'm reading it right now. And it says, without compassion, there's no healthcare. And I believe that 100%. We're moved into a very technical. Healthcare has become very technical. We've got lots of different things that we can hook people up to help people to live longer. But without that, the people at the bedside that are showing the compassion, I don't believe we're going to improve people's health and well-being. So, that's where I am philosophically, and that's what I firmly believe. And so part of being compassion and showing compassion is recognizing health equities and acting to reduce them.
So, not only just understanding and being empathetic, but being patient and really showing like true human compassion and actual that human connection to be there when they need you.
Yeah. Yeah. So compassion is that as a concept takes, the empathy, which is trying to understand that person and walk in their shoes. It's that one step more to actually taking action.
hmm
And so how do I
And
act, to reduce someone's suffering or to improve their health and well-being?
and it sounds like some of these issues you can't just act, right? You need to be patient and
Yeah.
kind of heal these wounds that have been made by years of distrust and bunch of historical trauma and
Yeah.
everything that's gone on in this nation. So that is the last of my questions. So before we finish, do you have any final thoughts or messages you would like to get out there about the importance of addressing these disparities?
Um, I think it's every members of society to do this, right? And so I'll speak to the philosophy of a compassionate communities movement, and that's that as a society, it's everyone's responsibility to be caring for people that are in need. And so this movement started with palliative care. But I believe it extends beyond that. It's not just at end of life, it's across every a person's life course. So, how do we as a society recognize those that are in need among us, and then again act on whatever those needs are. And Kyle, I just want to, give you a shout out and say this is phenomenal, this podcast that you're doing. It's a huge problem that we have. And, we, the people that are privileged are the people that are healthier, and we
Mhm.
leave the others behind. And so I think just getting these messages out and helping people to understand the problem um, is a first step. And
Mhm.
I just hope that people that are listening um, will take up the mantle on this.
I appreciate the shout out, and I really do hope we do get a lot of people listening because everything you said just really puts into the perspective of how important this issue is and how we can help fight it. Thank you for your time today, and thank you for sharing all your knowledge and experience on the matter. We really do appreciate you coming on the podcast today.
It was my pleasure, and I thank you again.
Thank you. All right. Have a good night.
Good night.
So we just wanted to give a big thanks to Dr. Pfaff, who's obviously given us a lot of her time to give us some good insight on this topic. We also want to say thank you to Dr. Lisa Porter, Nick Philbin, and Genesis Flores. They've all just given us the chance to actually make this episode. And lastly, just make sure to check out our link tree, which has all the resources referenced in this podcast. We hope you enjoyed your time.